All right, good afternoon. It's 5 o'clock, which means we in Kentucky get together. We get an update on this coronavirus, and we recommit ourselves to doing what it takes to protect our loved ones, to protect everybody around us. And let's start the way we always start, by saying what we know is true, that we will get through this, and we will get through this together. I did it yesterday and the day before. I'm going to keep doing it. I want you to say it with me. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. I think it's important that we say it and we believe it because, as we've seen, things are going to get tougher as we go forward before they get easier. And we need to make sure, especially as generally cases are ramping up, that we are strong, we are resolved, that we use these days to make sure that we are ready to do what it takes to defeat the coronavirus. And every day I think I've told you how proud I am to be your governor. People who, by and large, are trying to do the right things. That see what this virus is doing in New York and other areas, that you know, based on what we have shown, what a national and international pandemic can do, and you know that it could take a serious toll on the health and the lives of our people. So you are doing what it takes. And what's so special is you're doing what it takes even when it's hard to understand what it takes. I mean, we are facing an adversary that can take the lives of people that we love, that the way to combat it is to stay away from each other. I know that's tough, and it's against everything that we feel, every way that we're raised, and pretty much every way that our society is put together. But I need you to be really strong and make sure that you're thinking about every single one of your actions as the day goes on. Because, and I'll talk about it in a minute, if you were on a golf course, which you should be able to practice social distancing, but 24 of you are standing around the practice putting green, then you frustrated everything you've done throughout the entire week. I know it's beautiful outside, but folks, this is real. And I want everybody to start thinking about the fact that if they don't follow the guidance, there is a real percentage chance that just doing something they used to think is social could result in real harm to another Kentuckian. But I want to start with good news. My belief through all of this, and I think it's true throughout the country, is we're never going to be able to enforce our way into the type of behavior we need to protect people. Instead, we're going to have to encourage our way there. We need your help to create positive social peer pressure. That's exactly what we need to make sure that we've got folks doing the right thing, because sadly 1 or 2 or 10 or 20 people doing the wrong thing can continue to spread the virus and put more people in harm's way. So every day, I've asked you to try to fill up social media using a couple hashtags. Hashtag Team Kentucky, because we're all in this together. Remember, it is your duty as a member of this Commonwealth and as a patriotic American to follow the guidance and to protect people. We've also asked you to use the hashtag TogetherKY, because we really are all in this together. Now, while we need to stay apart, we are truly more connected in this effort than ever in our lives, because it takes absolutely everyone. And I can't remember a time in my life where a collective effort was more needed and more necessary. Hashtag Patriot, because again, it is your patriotic duty as an American to do what it takes right now. And then hashtag Healthy at Home, because that's where you need to be. Every minute that you are not out grocery shopping or getting things you need, every minute that you're not out there exercising and getting the physical health that you need to be at home. It's where you're the safest, and it's where your actions create the safety for those around us. And what we have seen, the outpouring of examples on social media are incredible, and we want to keep highlighting them. So this is the first one. And folks, this is really important. I want to give a shout out to the Kroger in Elizabethtown. They have created, as you can see, areas on the ground where people with their carts have to wait while other people move throughout the store. This is one of the most important things we've talked about, that yes, your grocery stores are always going to stay open. And other types of stores, we're going to actually have to make sure that the ones that are still open, that there is social distancing in them. And we have some real concerns with that. But this is the type of behavior we want to see. Thank you to the Kroger in Elizabethtown. Think every day for your employees and for your customers about different and new ways that you can create social distancing. It's a large part of what I'm doing on the state level. What can we do every day or every week to provide that extra level of protection? And I hope this is the type of positive social peer pressure that will ultimately seep out to some other groups that we're going to talk about here in a little bit. Let's go to the next one. This is Damon Lee Ross, who is 7 months old. I know for young parents, this can be a scary time, but I also know that more time at home with a baby like this is a pretty special thing. We really appreciate all those parents because I will tell you, I've had a 7-month-old before, and it makes you want to get out of the house at different times for understanding how important this is. But we're fighting for this kiddo's world, just like we're fighting for everybody else's world. All right, so this is in Van Lear, Kentucky. This is ringing the bells at 10 a.m., which we're asking everybody to do. Whether you are a house of worship and have a bell, or you just have one and you want to walk out on your patio, ring them. At a time when we've asked people to ultimately be healthy at home, it can be lonely, it can be isolating. And this is just a way every day for everybody to hear that we are all in this together and that we will get through it together. And yesterday, as you know, right after our press conference, we got information that we had lost an individual in Kenton County. I light my house and now this Capitol up green every night that happens, but so many different organizations, universities, and cities doing the same. It's been really special to see. And what it reinforces is a loss to any family during this coronavirus outbreak is a loss to all of us. And if we feel that and we model that, then that helps us every other day be better about doing the things we need to do to keep this virus from spreading. So I've talked the last couple days at different times about young adults that might not be doing the right thing. These are absolutely doing the right thing, using their time, being creative, connecting with their friends through all the technological ways that we have. And I wanted to show this one today because these folks are doing it right, and I want them to be an example to others about not only the type of fun that you can have and the type of creativity that you can show, but the type of responsibility that you can also show for others out there. A little bit of other good news. I was asked a question the other day about rural hospitals and specifically ARH about a certain number of either layoffs or furloughs. We got the information back. They are all simply furloughs. Their individuals still have their health insurance and are getting benefit accrual, and that hospital is ready for them to come back. We are working with them. We are going to need them back. But I want to say to ARH, thank you for handling this situation the best you can. And at a time of a worldwide pandemic, thank you for ensuring that they have health benefits. We want to see that from all of our employers. Also had a question to update from yesterday about Dale Hollow Park. It looks like we have added a couple of rangers and others to Dale Hollow to ensure that we have social distancing. We did have issues with the bass tournament in Tennessee that led to several boaters being in Kentucky. But we are now posting additional signs. We have had people there the last, almost 24 hours, and we feel like things, at least during that period, have gone well. But let me remind everybody that we can't let a state park, we can't let a basketball court, we can't let a grocery store become a place where we violate our social distancing rules and ultimately spread this virus, because that puts people's lives on the line. All right, a couple of things, and I mentioned one. Golf courses. I know it was a beautiful weekend, but we can't, if we're going to keep these open, have large groups of people. And listen, a large group can be 6 of you really close together. We can't allow any crowds in Kentucky right now. So we're going to ask, again, our mayors and our county judges, and we as a state are also going to be sending folks out, that where social distancing is not being followed, we're going to have to close golf courses and other places like it down. We don't want to have to do this. But again, it's what we have seen, a lot of people doing the right thing, and when some do the wrong, it forces us to take action. But folks, I'm not doing this to be mean. I'm doing this because if that many people are together, every single one of their contacts is shared, and this virus spreads. And while it might seem like you're just standing next to somebody else that's playing in that day, you ought to treat yourself like you have the coronavirus, and you ought to treat them as somebody whose spouse at home works in a nursing home. And if you've got it and you don't know, and you're just enjoying a nice day, and you give it to the person next to them, and they give it to their spouse, and they go into that nursing home, then something really bad happens. All right, folks who are out going on runs, I'm really excited that you're doing it. Our physical health, and it's also for me, my emotional health, is really important during all this. But we need you to run by yourself or with your family. The moment that we start running with friends or running with a group is, again, when we take something that's a good thing and we need to be doing, and we end up using it as a way to socialize and to spread our contacts. Keep running. Keep running. We want you to do it. We want to be healthier as a state when we come out of this than we were coming in. But we just got to make sure that we do it right, and I know the vast majority of people out there are. Finally, stores. Stores that have the fortune of being open right now. You've got to engage in social distancing. You know, we've received a number of reports, mainly from home improvement stores, that we're going to have to look into, and we're going to have calls with those that run those facilities. We're going to have to ask that either those stores find a way to enforce social distancing, or we're going to have to see how essential they are. Again, this is something where, with all the sacrifice that people are making, everybody who's lost their job, everybody who's closed their business, every kid that is not in school, we've got to make sure that when we're able to go to certain places, that we do it in a responsible way, and responsibility is all that we're asking for. So before I get into today's update, I'm going to ask Dr. Stack to come and to continue the type of strong encouragement that we need to see.
Thank you, Governor. We'll try to be really strong on the encouragement here for you. So I want to thank you first. All the examples of kindness and caring that I see are really, really inspiring. So I've told you that people have said I maybe should smile a little bit more. That's probably good advice in general. It's hard to smile. This is kind of scary stuff. But the honeybee t-shirt that people made, I really appreciated. The Lexington fire crew who made signs and stood with the signs like this to show don't be a honeybee. I really like that. Thank you. Today I went for a walk in my neighborhood. There are teddy bears in windows and on chairs outside, I think for the kids. I mean, the community spirit is fantastic. But a caution, don't let the kids touch the teddy bears, and don't let the kids go up to the windows and touch the windows, okay? That defeats the purpose. But the spirit is fantastic, and I warm my heart to see that as I walk through the neighborhood today. But I got to tell you, we're at crunch time, all right? The next 2 to 3 weeks are pivotal. And you don't need me just to tell you that now. You just have to turn on the news yourself or look at social media and see what's going on in New York City, what people are concerned will happen in other parts of the country. This is crunch time. There's a number of different ways things can play out. We can make it play out really well, or we can make it play out really badly. And if you do the things the governor has asked you to do, that's the good scenario. That's where everybody has the best chance to stay healthy and well, and our family, our loved ones, and our friends don't get hurt by this like they might otherwise get hurt. So I have a few shout-outs today, and these aren't the good ones. So I've gotten reports there's a bunch of churches in Graves County who are still going to have services. You can't be doing that. I want you to think about it this way, and I realize this is a little bit more stark. But if you have a parish of 600 people and you're having services right now, how are you going to feel if only 500 show up for Christmas service this year? And that's the way you need to think about it. This is not a game. This is real. If you do these things, there are people who may not be around later this year to celebrate the next big event with you. There's a fellow in Mercer County who felt it was important enough to get tested that he left Mercer County, got a test, and now refuses to comply with the local health department at all to say who he was around, how he got exposed, who may have been exposed to him. So it was important enough to get a test, but it was not important enough to comply with the health professionals who are now trying to keep him and everyone else safe. You can't be doing that stuff. So you have to assume, and I don't mean this to be fearful of each other. I mean this just as a matter of practical advice. Assume everybody around you has the coronavirus. Just assume that the people that you're seeing on the street, the people you're sitting next to somewhere, have the coronavirus. If you keep that 6 to 10 feet between you and you keep the social distancing, you're going to be okay. If you're getting in close, if you're on the putting green with a whole group of people, if you're going to service, and I'm not picking on churches, if you go to Home Depot or Lowe's or some other store that's open because they're essential, and you congregate, you are endangering yourself and others. And this is not a time when it's someone else. This is a disease that knows no geographic boundary. Doesn't respect whether you're a man, a woman, or a child, although it is less harmful to the kids, so that's sparing, that's great, but the kids can get infected and share it with others, and it doesn't spare the older folks and the people with serious illness. It doesn't know if you're a Democrat or Republican, it doesn't know what state you live in, it does not care. So you have to all do this, or the sacrifices of so many are undermined by the few. So for the fellow in Mercer County, please, just do what we're asking you to. We're just trying to keep you safe and use the information you thought was important enough to seek. My final point here, I'm an emergency physician. I've said that before. For more than 2 decades, I have spent my professional career meeting people in the worst day of their life. So there's all sorts of minor things in ERs. But there's hardly any shift that doesn't go by that there's someone who finds out they have cancer for the first time, someone who has a heart attack, someone who has a stroke. Every single shift that I go to work in the emergency department, someone has just had their worst day. And my colleagues, my nursing staff and ED techs and others I've worked with have wondered for a while, how do you get through it? Because I deliver all sorts of bad news to people and have people say thank you at the end. And how do you do it? And I'll tell you how I've done it. People have to know you care. You have to be kind. And even though I joke about not smiling enough, I do smile at work. You have to smile. And if people know you care and your warmth and your concern for them comes through, people are a lot more willing to work with you and help you to do the things that need to be done. So I want to keep encouraging everyone. Be kind. Love your neighbor. Treat everybody as if they're your family, because if you don't know which one is going to be the one who spreads infection because they're not following the rules. And I want you to please, please, please be thankful and be patient for the healthcare workers, the doctors, the nurses, the respiratory therapists, all the others, the first responders, the EMS, the firefighters, the police officers, and the essential business owners, the grocery store workers, and all the others who are staying open to make sure that we can get through this as best we're able. Please be grateful, and please smile. You can smile even at a 6 to 10 foot distance, and your kindness and your concern will come through loud and clear, and that's how we're going to get through this. So please, we have a chance, and the great things you've done already have given us that chance to get through this a lot better than a lot of states. But now is crunch time, and I can't be more serious about now is the time more than ever to double down on all these measures the governor has asked of us and to do those to keep everyone well. So thank you again, Governor Beshear, for your leadership.
Thank you.
All right, thank you, Dr. Stack. So today's update, at least as of 4 o'clock today, is a pretty good one, all in all. We have 45 new cases. They break down, and let me remind you, this is all very preliminary information. It's all less than 24 hours old. Sometimes it's the county where someone's tested. Sometimes it's where they reside. Sometimes there's even a mistake in it. But when we give you an update every single day, and it's coming from now, I think at 15 or 16 different labs, that's the way the information is ultimately going to flow. So the 45 are 15 from Fayette, 9 from Jefferson, 5 from Hopkins, 4 from Boyd, 2 from McCracken, 2 from Taylor, 1 from Callaway, 1 from Lewis, 1 from Nelson, 1 from Scott, 1 from Franklin, 1 from Campbell, 1 from Kenton, and we can't confirm one of the other ones. And at least as of 4 o'clock, we had no new deaths today in Kentucky. If there is one before tonight, we'll put it out on our social media. But as of now, we have had a fairly good day in Kentucky. But I want to make sure that while everybody ought to be really happy about that, everybody should, that you do know where we are and where we're going. If you could put up the Philadelphia versus St. Louis graph. I can't get through one of these without showing it. That even in our best case scenario, where we flatten the curve, we are going to have an escalation of cases. We are in that escalation now. It is going to continue. We're going to have days where we have more positive tests than we did yesterday when we had 90-something. We've got to know that's coming. We've got to be strong and we've got to be ready. And we can't let a single day where we had a fairly good result compared to others change both our expectations and our behavior in getting done what we have to get done. And I just want to start throwing out some numbers each and every day about why this flattening of the curve is so important. It's because we've got about 4.5 million people in Kentucky. We've got a virus that spreads really rapidly. And when you look at our healthcare capacity, we've got about 18,500 hospital beds, about 1,300 ICU beds, and a little bit more of that in ventilators. And so when you look at our number of people and how the disease spreads, it's really important that we do a couple of things, and we start on it right now before we're in New York territory. In fact, we started on it a lot earlier, but that we stay disciplined on reducing our contacts right now. We have to make sure that we flatten this curve so that we don't hit a point where our healthcare system is overloaded, because that's when we will lose more people than we would otherwise lose. If we have more than those 1,352 folks, and we're working to get more that need a ventilator at any given time, that's when we lose folks that we don't want to lose. And so every step we're taking now, every little bit that we flatten that curve is a protection for other people that are out there. In the meantime, we're working on increasing capacity. We're doing it each and every day. It's from going out and finding all of the convertible ventilators. It's about expanding our hospital beds and looking at a number of options, including multiple hotels who we're close to being under contract with. It's about flattening that curve and preparing each and every minute that we have the opportunity, because we know, not just in PPE, where we are at a difficult and oftentimes a critical point every day, that we will hit a critical point in our capacity in the healthcare system, and it's our job to make sure that we have as few of those days as possible. Want to just talk about a few things that we do every single time because it's important. Number one, our website, kycovid19.ky.gov. That is the area where you can get accurate state information. This is our one source of that information. Make sure you visit the website first if you have any questions. Second, our coronavirus hotline, 1-800-722-5725. If you are well, but you are nervous, this is the number to call so that all of our primary care physicians or our others out there that are taking other calls about those that are sick have the capacity to take that. So this is a very important number for those that are nervous but well. When to seek care. We've been working on this. We're going to talk about it every day. I want this to be a part of our daily lives, and I want everybody out there to be able to say it and to know it and to understand it before they actually need it. It's if you're nervous but otherwise well, call the hotline. Don't call your local provider. Don't go into one of the healthcare facilities. Second, if you are sick but would have otherwise not sought care but for the coronavirus, make sure you call your primary care physician or otherwise call a member of our healthcare industry. But if you are actually sick or you are injured, then make sure you get the care you need. This, if we can internalize it, if we can live it, if we believe it, and we believe it's all our duty, is how we make sure, even when there are a spike of cases, that we have the healthcare capacity that we need. Because, folks, even when we have, and we're seeing a surge, but even when that surge gets bigger, it doesn't mean that everybody's going to need a hospital bed. For many people, they won't. For many people, their symptoms will be smaller, but sure, they're going to be anxious. We'd all be anxious if we're diagnosed with the coronavirus. So it's going to take us being strong, and it's going to take us being amazing neighbors to know that if we are going to be fine, even though we have this, that we make sure that hospital bed is there for someone who would not get through it without it. I think I said this yesterday or the day before. That's going to take heroic acts from Kentuckians each and every day as we move forward, but I hope that people view it that way, that when they are told or when they know that they could ride this out at home, they say there's somebody else out there, I probably don't know them, but I'm helping to make sure that they get the care they need. This is our test of humanity, and I know that we are going to pass it. We moved the primary election date to June 23rd, 2020. That's where it is right now. I'm not going to ask our poll workers, many of whom fall in this vulnerable category, to show up then if it's not safe then. We are doing everything we can to protect our seniors, and that's been tough. It's been very significant limitation in our nursing homes and other facilities. It's no visitation for the most part, except for end-of-life situations. I know there have been birthdays, both for the individual in the home. There have been birthdays for kids and great-grandchildren. I know that's hard, but know that we are protecting that individual and that we all have a duty to do that. We have, as you all have known, taken hard steps, and we have seen amazing sacrifice from people that are out there. We want to honor that sacrifice each and every day by all of us doing our part to flatten this curve, but what flattening the curve means is saving lives and reducing the spread of the coronavirus. A couple of tips that we try to talk about each day. Social distancing does not have to be social isolation. You have more social media, you have more FaceTime, you have more Zoom than ever before. Make sure that you use it. That the coronavirus spreads very easily. Don't be the person that tries to be the exception to the rule. Be a part. Be a part of our united effort to make sure that we protect one another. If you have the ability, donate or help create PPE. It's what our healthcare professionals need, and I got to tell you, it means a lot to them, given their heroic efforts when people chip in. Remember to ring those bells at 10 a.m. every day and fill up social media with that type of good behavior that we want to see. Also, if you've lost your job or you can't get a job due to the coronavirus, make sure that you sign up for unemployment. Unemployment is now open to more people and more categories than ever before. There is no stigma. We want to make sure that everybody who qualifies signs up. This is not going to last forever. And this unemployment, in part, will be a short-term way to get you through, to make sure that you have what you need. And thanks to some recent changes, there is more people who qualify, and there are also more benefits that are out there. Also, make sure that you sign up for Medicaid. And we're doing everything we can to make sure that everybody out there who doesn't otherwise have insurance or who has lost their job is going to be able to qualify for Medicaid. Just remember, in a worldwide health pandemic, I think everybody needs to have health care now more than ever. So make sure you sign up, make sure you get it. I've had to make tough decisions leading this government that I know has caused a lot of economic short-term harm. I want to make sure during that period that we in government do everything we can to help you get through. And then once we get through this, and we'll get through it together, we will rebuild, we will restock, we will make sure we come out of this in a way that creates a bright future for everybody. All right, so we'll open it up for about 10 plus minutes of questions. As usual, we'll go back and forth between folks that are here and questions that we have that have come in. I have one question here. Has someone at Green River Correctional Complex tested positive for the virus? There have been 2 individuals who work in the administrative staff that aren't in direct contact with the inmates that have tested positive, and the epidemiologists and others are ensuring that we know any additional spread that has occurred, but that is our information right now, that the only 2 positive tests that we have are from the administrative side. Joe.
County jails have decreased their number of inmates by about 28% in the last 2 weeks, and public advocate Damon Preston has called for all Class C and D felons in county jails or state prisoners to be released. Along with those, within 180 days of their sentence being completed, do you have any plans to do what Preston's advocating there?
The question is on county jails, which have released a number of folks due to this coronavirus, and then the head of public advocacy in Kentucky calling for a wider release on certain grounds. The plan that you just proposed is not one that we are specifically looking at, but I do have draft plans in front of me. Our hope is that we can put those into place this coming week. There are anytime you put together something like this, there are a number of different pieces of information and steps that have to be taken. I will say it will be more limited than what the head of public advocacy is either requesting or suggesting. Next question here. We've heard of at least 2 instances this week when the governor announced a positive case in an eastern Kentucky county during his news conference, only to have the local health department and government officials say it's actually a negative case. I can explain it. It happens in a couple of different ways. One way that it happens is where the test is given, even if the person doesn't live there, and it can sometimes take time to work that out. Sometimes people give different addresses and or could be staying with a family member, and sometimes we just get it wrong. We've got our epidemiologists and others that are working around the clock, and as you all know, we're now a couple weeks into this. They make mistakes just like the rest of us do. That Floyd County one we read yesterday was a mistake, and I'll own that. And for the people of Floyd County, we're sorry about that. But let me say that there absolutely are cases of the coronavirus in every county. And my concern, based on our mistake, and it's our mistake, is that the clarification which needs to happen lulls people into the thought that there isn't a case in that area, that there is not a person that has the coronavirus. Remember, this is in all of our counties, and a virus doesn't care about a county line. A county line is make-believe. It is something that we create for government and for the provision of services, but when we're looking at something like this, it's absolutely make-believe. We are in this as one state. We're all in this together, and so that's when I talked the other day about my concern with traveling to other states. I need you to stay in Kentucky. Unless you are going to take care of a relative or going to work, it is really important that you stay in Kentucky so that your county and the entire state can benefit from the steps that we've taken. The KY COVID site says there have been about 5,500 tests, but yesterday I said that including negative private tests, there have been about 15,000. Can I clarify the discrepancy? So the 5,500 from yesterday is the number of tests that have been directly reported to us. All the labs are supposed to report to the state. That doesn't happen, and it doesn't happen with the frequency and the regularity that it needs to. And that's a challenge, but it's a challenge created out of everybody ramping up, trying to do the most they can, the fastest that they can. What we are able to do is estimate from our positive rate and from information that we have out there that we believe, yes, there have been more than 15,000 cases in tests. There have been more than 15,000 tests in Kentucky. The vast majority of them negative, which with right now the 439 positive cases that we can confirm here in Kentucky. Are positive tests from the private labs being counted in the total infected count for Kentucky? Yes. Describe the difficulty in aggregating negative test results and total private lab testing in our state. There are so many private labs. They are running so many tests across the country, which is a good thing. They're trying to run more and more and more every day. Many of them are in all 50 states, and then some of them are just getting up online. Some of them we don't have the same familiarity with going in the past that we did. We hope as time moves on, we have more accurate information. Yes? The question is an update on the infant from yesterday. Let me see if we can get that before we close today. Joe?
Is there any, last week you mentioned some communications problem with U of L on their testing. Has anything improved with that? And how many tests are you getting, say, or on an average, say, from the UK and U of L labs that are now?
The question is, we had some communication issues with the U of L lab. Is that improving? It's improving slightly. We could use some more improvement. Listen, I like the folks at the university. We're communicating regularly. Part of it is the interaction with the public health department in Louisville. Which is a great operating unit. We're all working on it. But we aren't getting all the information as quickly as we need. But that's not the only one. I'll have to work on a number that we've had reported from UK and U of L. If I looked at where the UK's capacity is increasing, at least from what I can see, and U of L's capacity appears to be increasing every day. They're running, compared to what we saw at the beginning, a lot of tests. And if I had a choice between time spent reporting information to us and increasing capacity for tests, I'd take increasing the capacity for tests every single day. An update on whether Boyd County has a positive case. I believe we're reporting 4 cases. Now, those could be tests done at a hospital in Boyd County, and they could live in another county. But at least as of our records, it appears that we have 4. Concern about Lowe's and Tractor Supply store. The number of people in them, nearly impossible to distance, especially waiting in checkout. We're going to be working on this tomorrow. We have to make sure that the facilities that are open, and it's under the order, are doing everything they can to enforce social distancing. And if that means there are that many people in the store, you got to close the front doors until the store thins out. This is an absolute requirement, and it's got to be met. But let me also say, there's a duty on the individual side too. If you need to go to one of these stores and you pull up and there are a ton of people there, don't go in. That's how you get the coronavirus. Let's be smart. If there is a crowd that shouldn't be together, don't join it. And if a facility is too crowded at the time that you go, come back at a later time. Remember, we have two duties. Number one, to protect ourselves and our families from getting the coronavirus. And number two, to make sure we don't infect other people, treating ourselves like we have it in what we do every day. All right, question from yesterday that I have the answer on now. Reports about the coronavirus remaining in the air for up to 3 hours. If you enter a room 2 hours after a sick person is in there, is there a significant risk? So what we believe with the coronavirus is that it is primarily and in large part spread through droplets, coughs, sneezes, and that being left on surfaces, the type of spread that we would see with the flu. There are studies being done right now about it being able to remain in the air. But let me be clear, this would be an area with like a healthcare facility with a number of folks that are infected, or a small room with someone significantly infected. We're not talking about being outside. We're not talking about larger buildings. And so this is something that they are doing research on right now. But what people ought to be worried about is that risk of infection through droplets and how things are spread. What is my reaction to Representative Savannah Maddox's floor amendment to House Bill 322 that would allow people and businesses to sue over my restrictions? Well, I'm trying to save people's lives. And if somebody doesn't understand that, or if someone doesn't care, I don't really have a reaction for them. If after this people want to look back and say we were overly aggressive, that's a reality I look forward to, because it means our people were safer than what we anticipate is coming. That'll mean that there are fewer cases than we thought might happen. But I'm going to continue to do the right thing. People can put an amendment that let the whole world sue me. I used to be a lawyer. I can handle that. But I'm going to continue to do the right thing no matter what. And isn't this silly? At a time when we're all supposed to be in this together, we're all supposed to be doing our duty, and we're all supposed to be doing what it takes to respond to this worldwide pandemic. All right, that's all I got on that one.
I have a question about Tennessee. Have you talked to Governor Bill Lee, since you kind of called him out a couple days ago? And just to clarify one thing you said that day, has he ordered restaurants to close to in-person?
Question is on Tennessee and whether I've talked to Bill Lee and whether or not he's ordered restaurants and bars to close. Have not talked to him. They did an order on restaurants and bar closure a while after ours, but they still have forward-facing businesses that we have closed down in Kentucky that people can come into. And we know, listen, this came from health departments on our border whose people are driving over to frequent various businesses that aren't open in Kentucky. And we are taking aggressive steps, and we can't allow those to be frustrated. And right now, Kentuckians shouldn't be traveling at all, not just to Tennessee, but to anywhere else. You ought to be healthy at home. All right. Could you provide an update on the cases that have recovered? We did that yesterday. That's still the best number we have. We know that it is over 60. What's the projected peak date of the virus in Kentucky? So this information we're working on, and I hope in the next week we can start sharing some of that information. And it's all based on some really limited data. It's people trying to do their best with a very small amount of data. We know the next 2 weeks are critical, and we know that will impact the peak. Now, if we do our part, it will push off the peak a little bit, about when it would be, but it would also lower that peak. That's the way that we ultimately make sure that we have the healthcare capacity to protect all Kentuckians. If someone was on unemployment before the coronavirus and they've exhausted their funds during the coronavirus pandemic, what should they do now? So I believe that we have had a couple of slides on the extension of benefits. I believe that benefits have been extended. It's the other one for up to 13 weeks. Let us get the answer if that applies to folks that were already on unemployment, because certainly the coronavirus has affected people's ability to currently find a job. We'll take one more.
Remdesivir is an experimental drug treatment to treat coronavirus patients. Have you tried at all to get hospitals in Kentucky approved for clinical trials?
That's a good question, and I'll have to get you the answer out of CHFS for that. It's about a drug that some have been using in clinical trials to treat the coronavirus. Let me check with our cabinet for Health and Family Services on that. Okay.
There's a lot of activity at the fairgrounds in Louisville. Is that specifically part of the state's efforts?
The question is activity at the fairgrounds in Louisville. Is that a part of our state's efforts? We are looking at different potential plans that would involve the fairground. It is a place that has significant overall capacity. It has very good parking. It's easy to get to. But that is one of a dozen different plans we're looking at. I mean, our job is to be as prepared as we can be, and that's looking at smaller options of whether it is expansion of beds or otherwise to larger options as well. And anything of that size would certainly require significant help from the federal government. All right, folks, the next 2 weeks, we've been talking about it, are absolutely critical. We are in the surge, and we're going to have more cases. We're going to have more cases each and every day, and we ought to be prepared for it. And we're going to lose more people. That's going to be hard, but we've got to know that that is coming. We got to dig in and realize that our actions, more than ever in our lifetimes, impact other people, and we got to be mindful of it. You know, even if we just want to get out and socialize a little bit, we've got to realize that even though you want to do that for a really good reason, that it can significantly impact others that are out there. That is why we are more connected now than ever before, and that's why we have to be more responsible now than ever before. I do want to say I believe what you are doing is making a difference. We all believe that. And we believe that not just the aggressive steps that I put into place, but the vast majority of people buying into them and realizing that this is all of us, and that we all have a duty to one another to protect each other. I know it is making a difference. And my belief is when this is over, we're going to see that Kentucky did better with what we faced than just about anybody else out there. But I need you to be strong. As the days get nicer and the weekends are incredibly pleasant, I need you to be strong. We are not going to have to be just healthy at home forever. But in the short term, we absolutely have to. Doesn't mean you can't get outside, but it means you can't get outside in groups, and you need to get outside by yourself or just with your family. I'll end by saying this is the challenge of our times. In my lifetime, we have never seen something where we have had to change our lives, the way our society, our economy, in the way we're doing right now. So let's make sure that that sacrifice that we are making is effective. Let's make sure that we don't undermine it each and every day. Now, maybe 10 years from now, this is when we all sit around and look back at how we came together. We put the collective good ahead of our own personal self-interests. That we did something that a year before nobody would have ever thought was possible, to put every division we had aside and to live for each other and to make sure that other people can continue living because of our actions. I believe that while this creates anxiety and difficulty and fear, if we go about this right, it could be one of our proudest moments as a people here in Kentucky, that we lived up to everything we always believed about ourselves, but also as our Commonwealth. This is our time. This is our time. We talk about the greatest generation. This is our time. It's about protecting the people around us. It's about knowing we face a major adversary. This is our time to prove that we have what it takes, and I have faith in you. Thank y'all. Thank you, Virginia, and thank you, James.